How has COVID affected your job?
Beautiful. So this is truly, the focus is about the veterans. And I think that is to remember that the purpose of that the government promised the veterans that this is the health care that they are going to receive from, from the United States because they serve their country. So with that, we know from the very beginning, we pledge during the orientation that we are going to serve the veterans. So with that, when COVID-19 came along, the focus was to protect the nurses, to protect all the healthcare workers, and to protect the veterans. So there were processes in place where the veterans face-to-face were cut down instead of full-blown face-to-face where they could just come in as a walk-in with no appointments. There would be an appointment, but there is also a walk-in. You can come in anytime, like an urgent. If you have a headache, you can come in. If you have an eye ache, you can come in. So with that, they reduce it to like 10%. So that means if it's really very important, you can see, but you will be screened. So there's a process in place. And I was a part of that too during that time. And the nurses were at the height of it, like about in March and April, when the cases in Houston went up. The nurses, like 10 nurses from within were moved to the inpatient units to be in acute care units, where I followed all their clinical competencies. We made sure that during that time, their competencies were, their annual competencies are being done. So no wasted time. Some were stationed outside to do the triage coming in, who needs to be seen by the physician. They switch most of the face-to-face appointments with the primary physicians into video connect and telephone. So those were the platforms that immediately were done. So now they are easing back. It's actually now 70, I think it's 50% are face-to-face. But now the cases in Houston is up again, really up. So the vaccination now is what the focus is. Vaccinations of the veterans. Even on the weekends, there are veterans coming into the hospital for vaccinations, but very systematic, like about 60 a day. They called, like 75 and above, they are being given vaccines. Now, just this Friday, we started doing the vaccination inside the clinics. So what we do is we have there patients that have an appointment, with an appointment will have an option to get the vaccines, 75 and above. So last Friday, we vaccinated 18 veterans. But again, yesterday and today, there are 4 nurses out there working, vaccinating veterans.